Many times people say to me, oh, you do anaesthetics because you don't want to talk to people. That's a common misconception because, oh, your patients are asleep, so you don't need to talk. I actually think it's quite the opposite. I think one of the most important things for an anaesthetist is to have excellent communication skills, because sometimes we have a very short period of time to meet our patients and to talk to them and to let them understand what's going to happen, to get information from them, to work out how they would like things to proceed. But furthermore, we have their patients' families to consider, and also all the members of our team. We work with surgeons, nursing staff, administrative staff. So we have to be able to enter a room, communicate with all these different people. Sometimes there's high tension and high stress. So we need to know how to de-escalate situations, how to get the best out of every team member. It's so interesting because sometimes we work with teams that we've worked with for 10, 20 years, and that's a really easy way to work. But also sometimes we find ourselves in teams where we know no one else in the team. And in a really short period of time, we have to get control of a situation, ask everybody to perform their roles at their highest standards so that we can get the best outcome for our patients.
I think someone who is compassionate and cares for people. I think someone who is curious and wants to have the knowledge as to how to be a better anaesthetist, whether or not that's in day-to-day work or whether or not that's in research and trying to help other people provide better care. And also someone who has the skills, not necessarily just the physical hand-eye coordination skills, but also the communication skills and the people skills.
Somebody who is empathetic, somebody who has fantastic communication skills and can communicate with the patient and with their whānau in a way that's really meaningful for them and what's important to them, the risks and benefits, and just narrate what's actually happening in the operating theatre. I think that when you look at the bell curve of risk aversion and risk appetite, that we probably lend more to risk aversion. But at the same time, you need to have the confidence and the ability to make decisions and act when you haven't got all of the information, for example. So you do need to be able to work with uncertainty. And you have to be very detail focused. At the same time, you have to have the ability to really zoom out and look at the big picture, whether it's the big picture for the patient or whether it's the big picture for the operating suite or even whether it's the big picture for the hospital, and work out what the best thing is to do.
I think you need to have attention to detail, but also be agile and flexible. Particularly in my role in paediatrics, children can throw some curveballs at you. And so you not only do you have to manage their physiology and deal with the pharmacology, but you also have to manage the psychology of the child, of the family, and understand that the social context in which the child comes can affect the way that they respond to the healthcare.